Hi, everyone. I'm Heidi, and welcome to our What to Expect Mom Haul, where today we're going to be tackling one of my favorite topics. No, not sex. Close, in the neighborhood. We're going to be talking about all things pelvic floor. And I am so excited to be joined today by pelvic floor physical therapist, Dr. Sara Reardon, AKA the Vagina Whisperer, who I've chatted with before on my What to Expect podcast. And Sara, you know that you had me at Vagina Whisperer, right? But I think technically you are whispering to the entire pelvic floor. Is that right?
That's correct. I would like to consider, I could say the pelvic floor whisper, but it doesn't have the same ring to it.
It kind of doesn't. It kind of doesn't. But maybe we'll get to that point. Let's talk pelvic floor. I think we should start at the very beginning. I like to start with basics just in case maybe some moms don't realize that they have a pelvic floor or know the significance of it. I always say it's it's the thing that you miss only once it's gone. But what is the pelvic floor and what does a pelvic floor therapist do and who should see one? When and why?
So this could be our whole hour. So just this one question. So to give you a little bit of introduction to myself, I'm Dr. Sara Reardon. I'm a pelvic floor physical therapist. So physical therapists typically work with muscles and tissues throughout the body, and I specialize in working with the muscles and tissues in the pelvic region of the body. So why this is important is there is a group of muscles here called your pelvic floor muscles that have really important roles. And I'm going to go over what those are. And then we're going to kind of lead into how does this relate to pregnancy and postpartum. So I'm going to bring out my little nerdy pelvic floor model here. We all are kind of, it's okay. We're all familiar with what our pelvis is, kind of this ring of bones here. And then you have your pubic bone here in the front, and then your sacrum and tailbone in the back. And at the very bottom of this ring of bones is a basket. So all of this red material that you see is actually a basket of muscles. And these muscles support your pelvic organs. So your bladder, which holds urine, your rectum, which holds poop, and your uterus, which holds a growing fetus during pregnancy. These muscles also have the openings for the urethra where urine exits, the vaginal opening for vaginal intercourse and vaginal birth and menstruation, and then the anal opening for poops. So if these muscles are working great, they can hold in pee and poop throughout the day, they can support your organs and your growing baby, and they can relax for intercourse or bowel movements or birth or urination. If they're not working optimally, they may be weak, which can often lead to leakage or prolapse or pressure, or they can be too tense, which can often lead to pain, difficulty emptying your bladder, difficulty with bowel movement. So they're super important. And as a PT, I specialize in working in this area of the body on these muscles specifically.
That's really important. And who would you suggest, I think a lot of moms are surprised to hear that it's never too early or too late
Totally.
to go visit a pelvic floor physical therapist, to get pelvic floor therapy or just learn about and understand their pelvic floor. Because there really is something in it for everyone. I'm always constantly suggesting this. So what are some of the pregnancy symptoms that pelvic floor therapy can help with and why?
So I recommend everyone who is pregnant to proactively start seeing a pelvic floor therapist. And I usually tell them to go at the start of second trimester, which is around 13 weeks. The reason for that is one, I think there's a lot that we can do to prevent pelvic floor issues down the line. So some of those things are teaching you how to modify exercise workouts so that you're not causing more damage or weakness to your abdominal wall or your pelvic floor, strengthening your muscles so that they can sustain the weight of a growing baby or pressure, and then also preparing your pelvic floor for birth. So we do a lot of strategies on teaching moms how to push properly, different positions for birthing, and then a lot on postpartum recovery. So for both vaginal and cesarean births, we do a ton of education on, hey, let's get your body ready for this huge race it's about to run and get a recovery plan in place because you may not follow up with a medical professional for those 6 weeks after. So like, what can you do to optimize your strength and then also teach your body to relax for birth and then recovery? So, I think during pregnancy we see women and anybody with a pelvic floor, so all genders, we see folks all across the lifespan, from as early as when they become sexually active or they have difficulty inserting a tampon, or even kiddos who have constipation or bedwetting, into later stages of life when, individuals have leakage or men have prostate issues or you're going through menopause and your body's changing. I think that I personally focus a lot on pregnancy and postpartum because it is one of the hugest transformations that somebody will go through in their life physically, and there's
Yes.
no training for it. It's like it's running a marathon with a sprint at the end, and nobody's kind of telling us like, hey, what can we do to kind of keep our body in the best shape possible?
Absolutely. And that is one area of muscles that you definitely should be working out during
Yeah.
pregnancy and postpartum. Um, what are some ways specifically to optimize your pelvic floor during pregnancy, so that it can hold up under all the challenges that it is currently facing if you're pregnant, and all the challenges that you may be facing ahead, postpartum, the potential wear and tear that all of us worry about?
Totally. So I think if we think about pregnancy, where you get those emails that are like your baby's the size of an avocado, then it's the size of a papaya, then it's the size of a watermelon. So if we think about this basket of muscles like a hammock supporting growing baby, if there's an avocado in a hammock, it's not going to change that much. But if you
Mm-mm.
put a pumpkin or a watermelon in the hammock, it's going to lengthen and get weaker and kind of stretch out. And that's really what happens to your pelvic floor muscles and your abdominal wall during pregnancy. So I really encourage folks to be proactive about strengthening their pelvic floor and core during the
Mhm.
first 2 trimesters of pregnancy. So in the beginning and in the second trimester. And then in the third trimester, I focus much more on relaxation. That's when we want your hips to stay relaxed, your pelvis to be mobile, to start working on different positions for birthing and even stretching after a cesarean birth. So really kind of softening into that third trimester versus like tightening, tightening, tightening. So that's probably one of the biggest things. Some of the other things I encourage folks to do are modifying their workouts. Like, you can't keep doing the same thing you were doing now that you have this adjustment in your body. So scaling back your workouts, learning how to engage your pelvic floor and not hold your breath during exercise. And then also not straining. Don't push when you pee. Don't, strain when you pick up your kids. Don't strain when you're pooping, because we all know pregnancy constipation is like a real thing. So really, managing the bowel and bladder stuff so that you're not bearing down, and then, optimizing the strength portions.
Absolutely. And I know that I always tell moms who are suffering from symptoms that are back related, hip related, sciatica, that there are options, that you don't have to suffer. And seeing a physical floor therapist would definitely, pelvic floor therapist would definitely help with that as well.
Yeah, and I think that that's so amazing, Heidi, that you do that, because I think the narrative has been like, oh, you're pregnant, that's normal, or oh, you're pregnant, it'll end when you have the baby. But
Nope.
pregnancy is hard, and I think that we want to make it as comfortable as a journey for moms as possible. And if you
Exactly.
had somebody in the community who had sciatica, they would probably go to physical therapy, or they had back pain, they would probably go to physical therapy. So why aren't we kind of proactively recommending pelvic floor therapy for moms who are experiencing those things? So it's not just the pelvic floor that we address in pelvic floor PT, it's the hips, the sacroiliac joint, sciatica, abdominal wall. Oftentimes there's like a separation of your abdomen called diastasis recti. We address all of those things because it's all part of your core, not just your pelvic floor. And we really want to optimize the strength and mobility of all of those things.
And a lot of it is prevention, correct? So that you don't have to wait for all of these things to hit your body, and start causing physical symptoms, but you're preventing some of them with the right therapy. Okay, so we've had this conversation, Sarah. I love my Kegels. Like, I'm doing them right now. And as my daughter Emma would say, ew, but no, I think I tell everybody to do them. First of all, what's the right way to do them? And when's the best time to to do Kegels? I can think of one good time during sex, but there are other.
There's a lot of things swirling in our heads. Sometimes we have sex. So if you don't do them during sex, that's okay too.
Yeah.
But I would say that there's a couple things when we want to talk about Kegel exercises is that if you have a weakness issue or want to be proactive in keeping your pelvic floor muscles strong, then doing pelvic floor contractions or Kegels to strengthen your muscles is fine. However, a lot of folks tend to have tension in their muscles.
Right.
So think about like if you have tight neck and shoulder muscles and you get headaches and you want to like have those knots rubbed out, that same thing can happen in your pelvic floor during any stage, but during pregnancy and postpartum as well. So if you have a tension issue, you'd want to work more on relaxation and not doing Kegels. If you do want to strengthen, a Kegel exercise is a contraction like my favorite way to teach people this is like, imagine you're sipping up a smoothie with your vagina. So it's like a drawing up and in.
Wait, don't try this at home though, right?
No, totally. I mean, try the action, but not the actual smoothie.
Smoothies are amazing when you're pregnant. Lots of nutrients, but let's not put them in your vagina.
Let's
but
not
yes,
put them in the vagina.
I love them before.
So think about it, if we're just kind of sitting here and you take a big, deep, relaxing breath to let everything go. And then imagine just like drawing up your vagina like you're sipping up a smoothie. That's what I really consider a pelvic floor contraction. You can try that when you're peeing. So when you're urinating, if you want to try that maneuver, it should stop your stream. So I don't want you doing Kegels all the time when you pee. You can just try it one time, but that's actually a pelvic floor contraction. What it's not is clenching your tush, curling your toes, holding your breath. Like those are not going to be the optimal ways to strengthen your pelvic floor. Once you learn how to do a Kegel, you can integrate it into all the workouts that you're doing.
Right. But I think the bottom line, so to speak, is that they are not the pregnancy and postpartum panacea that some of us, including me, always believe they were. Right. And that you've got to expand your pelvic floor horizons when it comes to pelvic exercises. And like you were talking, it was great also reference to the neck, because if you clench your neck all the time and you have neck pain, you're going to have more neck pain. You're going to be tighter. So we're all taking a deep breath here. So what are some other exercises that you can do at home besides sipping up a smoothie?
Theoretically, with your vagina. So
here, not there.
It's really about bringing Kegel contractions into other movements. So some of the easiest ones to start with are doing a bridge where you're lying on your back, your knees are bent, and you're like lifting your bottom off the mat. That's a bridge. But if you do a Kegel with that, then you're integrating that Kegel contraction into that exercise. If you're doing a push-up or a plank, you should be doing and holding a Kegel contraction with that as well. If you're doing a bar class or Pilates or bicep curls, you draw the pelvic floor in with that. We've always told like pull in your tummy and suck in your belly button, but really you want to think about pulling your pelvic floor in as well, because that's part of your core. And then that Kegel contraction just starts to become part of your daily exercise rhythm and routine. So really, squats, lunges, bridges, doing a ball squeeze between your knees, all of these with the pelvic floor contraction or Kegel are great ways to strengthen your pelvic floor as well.
And let's just underline that any exercises that you're doing, you should always clear with your healthcare provider, your prenatal provider first. But most moms should be able to continue or modify their workout routine, or even add to it if they've been, pretty much a couch tater up until that point. Right.
And easy to do. I mean, if you've got other kiddos, you work them into picking up your kiddo out of the bathtub or lifting the stroller into your car or carrying in the bag of groceries. So ultimately we want to use the muscles when we need them.
Yes. We always need them. Let's face it. So here's a new one, or relatively new, belly pumping, which definitely has my attention. And I would just love to hear your opinion on belly pumping, what it is, what it does, whether you should do it.
Yeah. So it's interesting because there's always kind of a new trendy way to teach people about how to optimize their pelvic floor. And it really comes back down to like the foundation of you need to stop straining, start strengthening, all these things. But one of the biggest things we talk about is sounds kind of nerdy, but it's like managing your intra-abdominal pressure. So what that means is think of your abdomen and your whole pelvic cavity like a balloon. And if there's pressure from one part, then it'll put pressure on another part. So say you pull your belly button in, we want to kind of keep everything into that balloon. What happens is when you have an area of weakness, like a hernia or pelvic floor weakness or diastasis, is that pressure starts to go towards the path of least resistance, which is towards the tummy or the pelvic floor. Pumping is a way to kind of contract your pelvic floor by decreasing the pressure in that balloon. So it's like you're pulling your pelvic floor and belly in, but you're pulling in and in and in and in, and then you're holding that for a prolonged period of time. I actually did a little bit of research before we chatted because this is a question that we get a lot. And the research is really showing that there is no difference between doing this pumping exercise versus doing pelvic floor contractions and integrating those into your exercise in day to day. So I think it's another tool it's a tool to achieve a similar outcome. It's not bad, but it's not going to be like the cure-all thing that you've never, that's going to solve all your problems. But it is a newer thing. I think it's good to chat about. It's a little bit hard, I think, for people to kind of understand the concept sometimes, but it's out there. It can be beneficial. It's not harmful, but it's not going to give your vagina magical powers either.
Oh, darn.
No, I wish I could say that it would, but it likely won't.
Yeah, I really wanted magical powers. Oh, well. You burst my balloon. But it's not a must do. I think one of the things we always have to keep in mind is there's so much pressure during pregnancy anyway. You got to do this, you got to do that. And let's not put extra pressure on moms to do all of these things and more just because they read about them. And of course, always clear anything you've read about online with your provider just to make sure that it's safe, because a lot of things out there are not as safe as they sound. So we touched a little on diastasis recti, which, besides the fact that it's hard to pronounce and something that everyone dreads, what is it exactly? And can you prevent it? And how do you treat it?
So to give folks an idea of what it is, you have your 6-pack abdominal muscles in your abdomen. I've never seen mine, but I'm told that everybody has them, right? So in between those 6-pack of muscles is a little bit of line of tissue called the linea alba. What happens when your body is expanding, your belly's expanding, is that tissue at the midline starts to stretch and thin out. Now, our body is really amazing because it's designed to, contain a baby and support a baby and then birth a baby. And so whichever mode of birth that you have. So, but that midline starts to stretch out. And what happens is that it gets thin and it starts to look like a little bit of a football or an alien at the midline of your tummy. So you'll see it a lot if you like lean back in a chair and you'll see like this little dome or cone coming out the midline. Or if you're doing a crunch or you're sitting up in bed, it looks like a little, football at the middle of your tummy. But what it is it gives you information that part of your body is weak and that you need to avoid the movements that cause that. So some of the things I tell people to do to prevent it and change if they have it is that you need to roll to your side to get out of bed instead of hiking up and down, like doing a sit-up maneuver or leaning back. Roll to your side, to get up and down, roll off to your side to get on and off your yoga mat. Even if you're on the couch, sometimes we lay back in these cozy couches, and roll to your side to push up instead of using your tummy, because those muscles just can't support the new weight that they have and the new strain. Other things are not straining when you're pooping. When you're pooping, you should be exhaling and not holding your breath. When you're giving birth, you should be exhaling and not holding your breath, because if you hold, I know. We're changing the way that we really, educate moms on this, because it affects your pelvic floor and core. So if we can have a different outcome with, still a safe and healthy birth, that's what we want. So I would say those are some of the things that I tell people, and then avoiding things like doing crunches and those kinds of things during pregnancy, because it's just going to thin those tissues and weaken afterwards. 70 to 80% of women have it at the end of pregnancy and at the end of 3 months. you can totally work with a pelvic floor physical therapist to rehab those muscles afterwards.
And what are some things that you might notice postpartum with the separation that you should be alert for? That, can it cause pain, interfere with activities, that kind of thing?
Sometimes it's associated with back pain because you don't have that core strength. So you'll
Right.
find a lot of moms who have a lot of back pain, a lot of sacroiliac joint pain. And then also there's a connection with pelvic floor weakness. Like if you have kind of
Mhm.
weak lengthened abdominals, the pelvic floor can often be weak and lengthened as well. So it all kind of comes back to activating, strengthening, regaining that core. I wouldn't say, I think there's two things to think about. If you're breastfeeding or lactating, things are going to stay lax for a little bit longer. Your
Yes.
tissues and your collagen just doesn't spring back the way it does for non-lactating moms. So be patient with yourself and just know that it might take a little bit longer. The other thing is that it's really frustrating for moms. I feel like they often feel like they still look pregnant after they're not pregnant. And that's often due to a diastasis. And I just want them to know that there is definitely help for them. It's a process. It may take some time, but it can definitely improve.
But just, to distinguish between like normal pooch that we all have after giving birth, you can look
Yeah.
6, 7 months pregnant when or more when you walk out of the hospital or
Oh,
birthing
definitely.
center. But this is a different kind, right?
This is like at 3 months postpartum, when you feel like it's still like your uterus should be shrinking down by the 8
Yeah.
to 12 week mark. So
Right.
after 3 months postpartum, if it still looks that way, also if it's worse after eating, if it's causing pain, I mean, those are some signs of a hernia too that you might want to get checked out. That's
Mm.
why I'm always like, go to the follow up with your medical provider. I really encourage all moms to check in with a pelvic PT at 6 weeks postpartum. I mean, they'll be able to walk you through like, hey, what's normal, what's not, do we need to send you to the doctor, or can you just work on some of these things at home?
Great. So, what are your thoughts and recommendations about pelvic uh, belly s- uh, belly supports?
Yeah.
Um, Everybody's using one. What are your recommendations for when to begin them, how long to use them, how much to use them, and what kind?
Such a great question. I really encourage being proactive in supporting everything. So I say, kind of in the second half of your second trimester, and definitely in your third trimester, use a belly support. We're not talking about a binder that wraps around it. It's almost just a
Right.
little something that kind of goes underneath your tummy. You can get some very inexpensive ones online. There are more kind of sophisticated, fancy ones, but just something to help support your belly and almost like hug it a little bit to the body. It just takes some of the pressure and weight off. It can help with minimizing diastasis. It can help with back pain and hip pain. So I just proactively tell people to start wearing them definitely in their third trimester. You also want to look for something that's more compression versus like tightening. So there are
Mhm.
some support, they're almost like Spanx for pregnancy, but they come
Right.
up over the vagina, over the belly, and they just kind of, it's almost like a hug for your belly and your vagina versus like a squeeze. So what I love about those is you can also use them postpartum. You do not have to use a postpartum binder or a waist trainer. I would recommend against using a waist trainer. Think about squeezing a tube of toothpaste in the middle. Where does that toothpaste go? Towards the bottom, and that's your pelvic floor, and we don't want more pressure on the bottom. So again, using those compression supports after pregnancy are great. If you have a cesarean section, you have multiples like twins or triplets, or you have a significant diastasis recti, just a little soft binder that they can give you in the hospital is sufficient.
Okay, great to know. And then what about pelvic floor exercises that help with pelvic girdle pain?
Yeah.
Like, first of all, can you help us define pelvic girdle pain besides as a pain like no other?
Right. So we talked about our little model here, and this is really what we call your pelvic girdle, this whole complex. So pelvic girdle pain could be at the pubic bone, which is like, it feels like lightning crotch, where you
Oh.
stand on one foot to get dressed, or you get out of the car, the shower, and it's like a sharp shooting pain in your pubic bone. Or it can be in the back. Same thing. You feel it when you're rolling over in bed, or when you stand on one leg, or you're walking stairs. all of those ligaments in your pelvis are getting soft and relaxed during pregnancy, which we want to accommodate the growing baby. We want it. That's the
But
role of it.
it's a love-hate. It's a love-hate because
Love-hate. It's a great way to put it. You're right. It helps everything change, but then it also makes you a little bit loosey-goosey too. So one of these little supports that you can get during pregnancy is great. It lifts your belly, but it also kind of wraps around your hips. Doing pelvic floor contractions also stiffens these joints. So just doing pelvic floor contractions with your workouts, with simple things like bridges or ball squeezes or squats, that stiffens these joints to keep those ligaments a little bit tighter to prevent some laxity. And then my favorite thing is like a massage to your glutes and your back. Just get a little tennis ball or massage ball, put it up against the wall and really roll out all the tension in your glutes and your low back. And that's going to help soften some of those muscles that are just clinging to keep everything together.
I think you had all the mom's attention with massage.
Or you can just go to somebody and have them do the massage for you. But that's fine too.
Yeah, someone who's trained in
prenatal massage, absolutely. But just even that little massage ball, I keep one at my desk, I keep one in my car, and just releasing some of these knots over time. Your body is working really hard during pregnancy, and so you do need to give it some TLC.
Absolutely. Nurture yourself and all those muscles. Oh, and getting out of cars. I feel like getting out of bed, getting out of cars is even trickier for those who experience that kind of pain. And someone gave me maybe it was you, a great idea about keeping a garbage bag that you can slide under you so that you can slide more easily out of the car.
Oh, that's interesting. I haven't heard of that. You can do that with a pillowcase. So you can even just use a pillowcase for that. But the other thing is I tell people to keep their legs together. Like think of yourself like a mermaid. And so to get out of the car, instead of doing one leg and then the other, you just swing both legs over to the side and then scooch to the edge of the chair to get up. Same thing when you're getting out of bed, kind of like roll over to the side, keep your legs together and then sit up, and then without kind of separating your legs.
And especially when you're postpartum, trying to get out of bed for the first time in the hospital birthing center, that's really important. What are some postpartum healing tips for the pelvic floor? So we know your pelvic floor, you've tried to nurture it during pregnancy, you've done all the TLC, but then you give birth, right? And whole different story. So we're all going to have some healing to do, probably a significant amount of healing, because you can't expect to, go through the pregnancy and the weight of the baby and all of those other challenges, the weakening of the ligaments, and then come out and just be perfect, fine, no matter what you do. So what are some good healing tips for postpartum?
So I think it really boils down to the basics if we're talking about really early postpartum recovery. So some of the most important things I tell people is, one, you're still going to be bleeding, regardless of what method of birth you if it's vaginal or cesarean, you'll still
Sarah, can I just say that so many moms who have a first-time cesarean don't realize they're going to bleed. So that's a really important always point to make.
Yeah, so you're still, just to kind of have an expectation that you're still going to be bleeding down there. You're still going to need menstrual hygiene products, or, so that's just something to have on hand. The other, I would say, early postpartum tips are for pooping. Sometimes your first postpartum poop is like as stressful as having that baby.
I still remember that pain so acutely. All of these years later, I remember that.
So I'm like, why aren't we helping moms take easier poops after birth? So hands down, I tell people, start stool softeners when you're in the hospital day one. Talk to your medical provider and your nurse and start stool softeners day one for the first couple of weeks, and hydrate. The other thing is I tell everybody to get a squatty potty or a little stool under their feet to support their feet. Putting a stool under your feet puts you more in a squatting position, which relaxes your pelvic floor muscles to help you empty. So you won't have to strain as much.
And by the way, that's how we were programmed to poop, right?
Yes.
We didn't have toilets when we were created. So,
Yeah.
it's squatting. It's all about the squatting.
Yeah, and if you even watch little kids poop, they like run into the corner in their diapers and like squat on the ground, right? Squat in their diaper because it's the physiological way to like poop really easily. So I tell them to get a squatty potty. And then the other tips are if you have a vaginal birth, I want you to take a piece of toilet paper on your hand and you're going to hold the vagina like this when you're pooping. So what that does is it supports the vagina, which is vulnerable. You may have some tearing there, some stitches. So it's giving this area some support. So you hold the vagina here and then your anal sphincters here, and you exhale with that support to poop, and it's going to make it a lot easier. For a cesarean birth, take a pillow, put the pillow against your waist, same maneuver, but you're protecting your tummy and supporting your abdomen.
And of course, the reason why you're using toilet paper is to keep things hygienic rather than using.
Well, and you're going to have blood. You may leak a little bit of urine. So pee first, then take the toilet paper, hold it up. It's much more hygienic and cleaner. And then, but you're really helping manage the pressure so that you don't put too much pressure on your incision if you had a C-section, or even your incisions if you had a vaginal birth or tear.
And while we're on the subject, a lot of moms get hemorrhoids during pregnancy, and some even get them during delivery if they've perhaps pushed too hard the wrong way. So what are some tips? That's another area that you can help out with, right?
Totally. We don't think of like pelvic floor and hemorrhoids, but like butt stuff is our jam too. Like it's not just vagina. So it's the whole pelvic floor. So the stool softeners are a big thing. So, and then the other thing is baby your bottom. So whether you have hemorrhoids or a perineal tear, or, you really need to take it easy the first 1 to 2 weeks after birth. Like, I know that's hard if we have older siblings or we're really antsy to, get active, but the more that you can rest and relax and literally just work on hydration, peeing, pooping, nutrition, feeding baby, like those first couple weeks, then start easing into some walking and things like that. But when I say baby yourself, like baby your body, but for your bottom, you can take sitz baths a couple times a day to soothe hemorrhoids, to soothe perineal tears, and kind of really delicately take care of those tissues.
Do you recommend anything specific to put in the sitz bath?
I'm always mindful about what people want to spend money on. So it's honestly Epsom salt. I would just go get some Epsom salt, put it in there, and it can be very soothing.
Just like grandma did.
Right. I mean, some of these things really do hold value because they were so simple and there was kind of a reason they were around back in the day.
Oh, for sure. And no ifs, ands, or buts. To say. Okay, so now we're going to move on to a subject that I think a lot of new moms, but also pregnant moms think a lot about, and that's our bladder.
Yeah.
Our bladder can take a beating as well during pregnancy and postpartum. And as a result, sometimes pee happens.
Yeah.
When we least expect it, or when we least would like it to happen. And there's a sense of urgency and a lack of control. So first, starting with pregnancy, what are some of your recommendations?
So if you start, so it's what, obviously we talked about this hammock supporting growing baby, but it also supports bladder. And this hammock has the sphincter that keeps pee in during the day. If that sphincter muscle gets lengthened, weakened during pregnancy, it's just not going to be able to support that. So a couple things are like, don't delay the urge to pee. If you have to pee, pee.
Gotta go.
Right. The fuller your bladder gets, the harder it is to hold it in. I don't want you going every time you pass a bathroom, but go when you have the urge to go. The other thing is, if you do have leakage during pregnancy, it is a fine time for you to start seeing a pelvic floor therapist and or working on strengthening, because it doesn't necessarily go away postpartum. So that's an early sign of like, oh, my pelvic floor is not operating the way that I want it to. Let me start working on this now, either strengthening or therapy. On the postpartum side, obviously there is some amount of leakage that can be really common, especially in the first couple of weeks. Like, you may get up from the hospital bed and you're like, oh my gosh, it feels like my water broke, but I think it was my bladder, and your pee has just, like, your muscles are just tired and they can't hold anything in. If around 6 weeks postpartum, you're still leaking, leaking urine, that's a time that you need to start working on it as well, because it's not necessarily going to get better on its own. So leakage with coughing, sneezing, picking up your kiddo, walking to the bathroom with the urge to go. Those are all signs of, again, I probably need to work on my pelvic floor a little bit.
And during exercise as well, if
Yeah, so
you're
around 6 weeks postpartum, if you're ready to go back to working out, that's when you start bringing in those pelvic floor contractions. And we don't recommend anyone running, jumping, or doing any high intensity exercise until 12 weeks postpartum. You need to spend those first, 6 to 8 weeks post, before then, strengthening your muscles before you do a lot of high impact activity.
And even you said, if the leaks continue, would you say it's normal during pregnancy? Or is it a red flag if you are, springing a leak every time you watch a funny movie or, you sneeze suddenly? Or cough?
So I'm in the school of thought that it can be common, but not normal.
Okay.
And I think we want to differentiate between those two things is that, yeah, do a lot of people experience it? Totally. But should we work on it? Yes, because it doesn't necessarily get better. And if anything, it could potentially get worse. And I don't think that we want our destiny to all be in diapers, So I think you want to be really proactive about working on it if you do have the symptoms.
That is good information for everybody to have. I think we can all agree on the diaper part. Diapers, keep them for the babies. What are things that, I think, and I also wanted to mention in terms of bladder control, moms who have are vomiting a lot often also have problems with that, with leakage. So same thing.
Like pushing of vomiting, and think about like this big push on your pelvic floor. Those muscles can't support against that. So we might see it more if you're sick during pregnancy and you're coughing a lot or sneezing, or if you are vomiting. And if it kind of goes away after that big event, then I would be like, okay, you could be, it might be better. But if it's still happening even after those episodes, I'd be like, oh, let me just go get it checked out and make sure that I'm not, this is getting better and it's not going to get worse. But that's a great point to bring up, Heidi.
And, the other thing is, if you are in a situation where peeing yourself might be inconvenient, then are there any things you can do in that moment to keep that in? Yeah.
A couple things. So one, wear a liner, and then continence liner, not a maxi pad, because not all liners are the same. Two, I actually tell people to put a ball between their knees and squeeze the ball when they're puking. So it sounds crazy and hard to execute, but if you take like a little exercise ball or a soccer ball or whatever, a pillow, and if you squeeze your inner thighs together, it helps turn on your pelvic floor. So it just gives you a little bit more protection down there.
What about teachers during that moment?
You can, but it's hard. I mean, it's like kind of like you almost feel like you're swimming upstream. So you can try to do a contraction, but that's almost what the pillow is doing or the ball. It's like if you squeeze it, that's almost like you're making yourself do a Kegel. And the last one, go ahead.
I'm sorry, just when you're in a meeting, you may not have,
Oh, yes. I thought you were talking about if you're puking over the toilet. Yes.
Oh, yes.
Do a Kegel before you cough or sneeze. That's kind of like the rule of thumb from here on out.
Right. Okay, perfect. You were going to say something else about.
Oh, I think another trick that's a little bit interesting that we don't talk a lot about, and I would always tell people to check with their medical providers, is actually inserting a tampon into the vagina. And what that does is it supports the bladder wall. So it's almost like a mini pessary. Like if the muscles are weak, then the bladder moves every time you cough or sneeze, and that's what causes leakage. But if you insert a tampon, it just supports that temporarily. So if you're in a meeting and you've been sick and you're worried that you might cough or leak, or if you are, leaking and you are going on a plane ride and you don't want to like worry about it, or even if you're trying to run and, I would say just proactively use a tampon and then you take it out after, obviously. You can't leave them in more than 8 hours, but it's a great way to just give your muscles a little support when they're fatigued.
Is that during pregnancy as well? Or just postpartum?
Pregnancy as well, both.
And that's why we should always check with a provider.
Always check with your medical provider.
Yeah. Okay. Everybody's like, I did not want to use a tampon for.
I know. That's one of the benefits of being pregnant, right? So I know.
I lost my tampons. Now we're back to my possibly my favorite subject, sex. So you point out that sex should not be a pain. I mean, initially, the first few times you're dry because of hormones,
Right.
hormonal changes. You've had lots of wear and tear down there. Plus, you're so not in the mood, and that is cool. But how do we know when sex, whether it's during pregnancy or postpartum, is painful and that's a red flag?
So if you are at the 3-month mark postpartum and you're experiencing pain with sex still, that's a red flag that you need to get it addressed. Typically at the 12-week mark postpartum, like when we're out of that 4th trimester healing phase, if it's pain with sex, if it's cesarean scar pain, if it's urinary leakage, if it's diastasis recti, those are all signs of I need to get this addressed because the research shows they're likely not going to go away even after a year of postpartum. So sex, some of the common reasons that sex is painful after birth is one, vaginal dryness, like you mentioned. If you're breastfeeding or lactating, your estrogen levels are lower, and that causes some thinning and dryness of the area. So using all natural moisturizers like coconut oil, or talk with your medical provider. There's a lot of all natural ones out there. Is going to be beneficial. And then also using a water soluble lubricant during intercourse. Just proactively use it before you even test the water. You want to make it as comfortable as possible. Scar tissue. So scar tissue at the vaginal opening is another reason. Things are just tight and restricted. If at 3 months it's still painful, a PT can help you massage it and show you how to massage it. Or even a cesarean scar can also cause pain with intercourse because the connection between the abdomen and pelvic floor is so close that cesarean scar restriction can cause pelvic pain as well. And then the last one is muscles. If you've got tight, tense muscles, that can cause pain. So pain, the first time you have sex, it might be painful. If it continues to be painful, it likely won't go away, and I would check in with somebody. And we have enough roadblocks as to why we don't want to have sex after having babies. Let's take pain as one of those reasons off the plate. So we've got a lot of other reasons we want to avoid it, but pain, I don't want to be one of them. It really should be pleasurable and not painful.
And in general, pain, postpartum, pelvic pain, pain of all kinds. When do you feel the same 3-month mark that you should check in with?
I mean, that's a pretty like generous time frame. I really think if we look at pain like it's information from our body, pain is information that's telling us like something's not operating the way it should be. It's either a tight muscle, or it's a scar tissue, or it's, something's not optimizing the way we want it to. So I would say, any more than a couple weeks, and even that's generous. But if you have pain and it's not going away, get it taken care of.
Or it's getting worse.
Or it's getting worse.
You should see gradual progression.
If it's not getting better and it's getting worse, go for it. If it's getting better, you might be on the right track, like a one-time thing. But otherwise, take care of yourself and definitely take care of it.
And speaking of C-section recovery, I think some are really surprised to find that even if you're not having a vaginal birth, you can benefit from seeing a pelvic floor therapist. So can you explain why, and what are the things that you can do to help prepare for and help speed recovery from C-section?
Yeah, so I always say a vaginal birth doesn't necessarily ruin your vagina, and a cesarean birth doesn't necessarily save it. So pregnancy itself affects your pelvic floor and your core. So anybody who's had a baby or has been pregnant, I should clarify, is appropriate to see a physical therapist. Many folks who have a cesarean have either been pushing for a long time, and that can cause weakness. If you have a C-section, your abdominal muscles have been cut. Your abdominal's been cut, there's scar tissue there, there's weakness there. We work on all of those things: constipation, incomplete bladder emptying, urinary leakage, painful sex. All of those things still affect C-section moms, potentially.
Is there anything you can't do, Sarah? I'm just wondering.
Yeah, lots. And don't come to me for neck pain. or like, that's not, yeah, I can't help you there, but like in this area. And I think that's the thing is we're learning so much about our bodies and that there's so much that we can do. I mean, I was pregnant when I was a pelvic floor PT, and I had two really amazing births and two really good recoveries. And I was like, I think more people can have this experience. Like I just was lucky and chose the right field, but I really think everybody needs access to this information.
Either that or everybody's got to go back to school and become a
Right.
physical.
Well, it's a long road.
Um, so we do have some questions from our live audience, and a lot of familiar ones. How do you push properly during delivery? You touched on this a little bit. I pushed with my face. Consequently, I was covered. My eyes were black and blue. My face had black and blue marks all over it, and I pushed for 3.5 hours. So I wasn't pushing effectively.
So the biggest thing for folks to know about pushing during a vaginal birth is that you have options. You always have options. So if you feel like a certain method that they are telling you how to push is not the right method for you, then you have another option. The way that I tell people that's been most effective for myself, my clients, and is supported in the research is that you exhale while you're pushing. So instead of going, you
Yes.
push, you exhale as you're pushing, like you're blowing out a bunch of birthday candles. This is the same way that you're supposed to be pushing when you poop. So I'm like, practice this during pregnancy. Every time you poop, exhale like you're blowing out candles, your pelvic floor muscles open and relax. And that's the way that you're going to push during birth. The other thing is spontaneous pushing when you have a contraction versus coached pushing. So oftentimes they'll tell you, for 10 seconds, push for this long. And it's really when you have contractions, which you can either see on the monitor or you can feel if your epidural is low or you have an unmedicated birth. So push when you have contractions versus pushing when they tell you to push. And you can push in different positions. You can push on your side. Even with an epidural, you can push on your back. Know that you have options.
Yeah, I wasn't given the options back in the day, so I was on my back, the least effective way
Well,
of
that's
pushing.
still the case for a lot of folks. So you're not alone, Heidi.
No, and that's why we should also have a doula, PS. So now we have two people to help us on our team because
Yeah.
it does take a village. Does Pilates and prenatal yoga help with your pelvic floor?
I love Pilates and prenatal yoga. I think the most important thing, whatever workout you want to do, is that you're activating your pelvic floor. So if you're doing a bunch of, scissor kicks or whatever, and you're not activating your pelvic floor and abdominals, it could cause more issues. So I would say it's fine to do, but make sure you contract your pelvic floor and that you modify over the course of pregnancy. You may not want to do single leg stance stuff anymore, or you might want to shorten your lunge or your twists. So just thinking about how you can modify some things as pregnancy progresses. But I think that they're wonderful.
And another mom asked, like, is this all possibly DIY at home that you can do yourself if you can't get to see a pelvic floor physical therapist? If the access is not there,
Totally.
can you do it, in consultation on Zoom, or is in person very best, or are there some tips at home you can try?
All of the above. So, I mean, optimally, we'd all love to see a pelvic floor PT,
Yes.
but cost or access or location can be issues.
Although you can get a referral, correct? And
You
there's some
can actually, in every state of America, you can see a pelvic floor PT without a referral. So you can walk in like you walk into an acupuncturist or massage therapist. Whether your insurance requires it is different, but in every state you can see one.
Okay.
You can do virtual sessions. And then I even have a whole platform that is specifically on like strengthening and exercise and birth preparation and postpartum recovery for this exact reason, because not all of us can make a PT appointment. So my whole program is really based on how do we get people this education that's really accessible and affordable in case we can't see a PT live.
And a mom who's had a bladder prolapse from a previous birth, she's wondering, is she doomed? Is she able to prevent this in future pregnancies? What do you think?
It's a great question. So bladder prolapse, for folks who aren't familiar with it, is when those pelvic muscles, that hammock, or it's not as supportive as we want it to be, and the
Right.
bladder starts to kind of drop down a little bit and push into the vaginal wall. So it almost feels like something's kind of falling out of the vaginal canal a little bit, but it's really the bladder pushing into the vaginal wall because of weakness. So good news is research shows that it's really subsequent births don't necessarily make that worse. Oftentimes it's the first birth of, it's a first time mom where it's more tends to be more prevalent. But I would say you want to make sure that you're not pushing improperly, that you're pushing effectively during a future birth, that you're not straining with bowel movements during pregnancy or postpartum, that whole pressure management thing we talked about, that you're doing things to help minimize the risk of it getting worse during those episodes. But a birth doesn't necessarily mean that you're doomed.
And what about perineal massage? Would
I
you
love,
recommend you started?
yeah, that's a great. So let's talk. Let me introduce you to your perineum, actually. So,
Hey,
so I know. Hello, Heidi.
working for you.
So your perineum is this area of muscle between the vaginal opening here and the anal opening here. So it's like grand central station of all of your pelvic floor muscles. And typically, if you experience a perineal tear, it occurs here towards the bottom of the vaginal opening or towards the side, but it goes into the muscle. So when we talk about doing perineal massage during pregnancy, we usually encourage it starting around 32 to 34 weeks of pregnancy, and it's inserting a finger into the vagina and pressing down towards this area. So it's like stretching the vaginal opening so that the perineum gets a little bit softer and stretchier. So doing perineal massage, it really can just be 5 minutes, 3 times a week. You can do it lying on your back. You can do it in the shower. I tell people to get into like Captain Morgan's pose with one leg up on like a stool or a chair, and you can use your thumb to go around your belly. But it does show to help minimize the risk of a more severe tear. And it can also minimize the risk of more severe pain. So you might still experience a tear, but it may be less painful and less severe if you do this. And then if you need to do massage afterwards, if you do have a tear and you have some scar tissue, you already know how to soften those muscles.
And scar tissue, how do you know if you have scar tissue? It's just a matter of gauging by the pain. Clearly, you want to go see your provider, but scar tissue is pretty common.
It is. I mean, if
Sometimes-
you have any kind of tear, that's probably more than a first degree. So a first degree tear is like a little paper cut. A second degree tear is into that muscle. So most often second degree tears and then into third and fourth degree, which are more extensive, will typically have scar tissue. When muscles and tissues come back together, they don't line up exactly the way that they were before, and things just get a little bit stuck. That's super normal. Just like when you have surgery, you have a little bit of scar tissue at that surgery mark, but we want to soften that tissue so that it moves and relaxes and softens to help you engage in intercourse or anything like that, but also to help strengthen. If it's tight, you're not going to be able to strengthen as well. So anything more than a second degree tear, I would say, or second degree tear and on, I would say you'd want to get it addressed.
And sometimes it goes undiagnosed, correct? And
You may
just
not have issues with it. Yeah, you may feel fine. It may feel like totally normal. But more
or again,
often,
you may assume that pain postpartum is normal, and we've sort of clarified that, I think, for the record.
yeah, and even weakness. Like you may be like, oh, it's just weak, but some of it maybe things are kind of stuck, and you need to soften them and then strengthen them.
Excellent. So mom was asking about Kegel weights and toys.
Yeah.
What are your thoughts? I mean, not those kinds of toys, but specifically
Or
for
maybe, I mean, so I would
I
say,
mean, you can. Let's clear that up right away. There is no reason why you can't use the toy.
yeah.
Please.
So Kegel weights they're little, they look like little cones that you put inside the vagina, and the vagina kind of squeezes around them to keep them in. You have to have a certain amount of strength just to even start using them. Like if you put it in and it falls out, you're going to feel pretty deflated and pretty frustrated. And so you need to start by being able to actively strengthen with Kegels and then insert a light weight. And then what I do tell people to do is actually practice the contractions with the weight in to help make it more effective. It's like going from doing a bicep curl with no weights to adding like a 3-pound weight. But to strengthen your bicep, you don't just walk around like this all day, right? So to strengthen your pelvic floor, you don't just walk around with a weight in your vagina all day. You have to contract and relax. So they can definitely be helpful. If you do use them, don't use like jade eggs or Kegel eggs or things like that because they're porous and they can hang on to bacteria. So use a medical grade silicone toy that you can, or device that you can clean.
And thank you for emphasizing that. We want to stay away from those eggs. So
Eggs are a hot commodity now, but not
actually they are, but we want to eat eggs because it's a source of nutrients and protein, and they can be full of omega-3s and vitamin E, but not the eggs you place inside. Just like the smoothie, we want to be careful about what we put in our pelvic floor. So a mom wants to know a little bit more about the sling and support, in specific for postpartum, when to start using them, and a vaginal delivery, is it advised to use them? You kind of already covered that, but you would say it's a should do, must do.
So it's a can do, don't have to do. If
Okay.
you have prolapse, varicose veins, a lot of pelvic floor weakness, I like these compression. They're almost like compression underwear, almost like Spanx, where it
Yeah.
comes from below and wraps over your belly and underneath your pelvic floor. You'll actually want to wear that right after birth. So for maybe the first 2 to 4 weeks. They're great because you can put a little ice pack in there if you have any soreness along your incision vaginally or your abdominal wall. But after 4 weeks, you really shouldn't depend on any sort of device to pull you in. You want to start working into Kegels and abdominal strengthening and walking and other types of strength building activity than relying on a brace.
And yeah, that's something I was going to ask you about, because can your muscles become dependent on using a sling or support? And is that something to consider if you use it too often or too long?
Yeah, I think that if you're not contracting your pelvic floor and you're using it for that support, then you probably want to start thinking about how can I get off of this support? It's almost like wearing a knee brace. Like you can wear a knee brace forever. It's not going to make things worse, but you're probably not going to make things better either. So yeah, I think you'd want to think about after a certain period of time. And this is postpartum. During pregnancy, brace up. But postpartum, after about that 4-week mark, you want to start thinking about doing some real rehab to help support you.
One mom asked again about sex and about related to tight muscles, and again about relaxing and massaging. Do you
Yeah.
massage before sex, or just lots of foreplay, not
Yeah.
foreplay, but
Or that.
on your
Um,
back after 4 months, but yeah,
so
foreplay.
when you have pain with sex, there's two, pretty major components. One is a muscle or a tissue issue, but the other is an emotional, psychological component. And they're
Mm,
actually really closely connected. So if
they
you are
are.
running off of a high intensity day that's overstimulated and anxiety provoking, to snap right back into that mode of sexual activity is really tricky. So I
Yeah.
actually encourage people to like do a little bit of down training to their nervous system before even trying to have sex. So that may mean doing some big deep breathing in bed, doing some needed chest stretching or a little child pose or yoga, like softening your body, but softening your mind. And that prevents a lot of that tension that we just hold in our body throughout the day. And then some things that do help are taking some big deep breaths during intercourse, especially the first time after giving birth, so that you're not clenching in fear, using a lubricant, things like that really help soften the whole experience.
Maybe some mood music, maybe a scented candle to get rid of the pervasive smell of baby spit up, that kind of stuff.
Yeah, and try them. I mean, but like, don't have Game of Thrones on in the background. Like,
Yeah.
chill the experience
Unless,
out.
unless that's what gets you going.
Unless it's what gets you
We're not here to judge.
but
Yeah, and I think that's a really great point, because whether you're about to poop, you're about to have sex, and you anticipate the pain. I remember doing that, like, this is going to hurt so much, and you clench, and that's probably the worst thing you can do. If you can possibly relax, that's a much better
yeah,
strategy.
and breath is powerful. You can't clench and breathe. So breathing is really your most powerful tool to quiet your nervous system, to relax your muscles throughout the day and with certain activities like pooping or intercourse or urination, any of those things.
Awesome. So I think we've run out of time, though we could be doing this all day long. I think we can do that. I'm sure the questions will keep coming in. But I did want to thank you so much, Sarah, for joining us, for all your
Thanks for having me again.
wisdom and your sense of humor, because if you don't have a sense of humor when you're dealing with your pelvic floor, except for the part where you're peeing when you're laughing, but still important to have a good sense of humor. And everyone, thank you so much for joining us. And Sarah, everyone out there, here is to a happy, healthy, well-nurtured, necessary, well-oiled pelvic floor that lasts a lifetime.
Thank you, everyone. Thanks for attending. Thanks, Heidi.
Because bye.
Bye.